First, I want to say that as far as conflict of interest goes, I have 100% conflict here. As a stakeholder, yes, I'm a beneficiary of the healthcare system. So I have a conflict of interest. I have a good opinion about the healthcare system, whether it is the old system or the current system or the way where we are going ahead. I have an interest. As a beneficiary, I have an interest. As an administrator, I have an interest. As a university official, I have an interest. And as a care provider, I have an interest. We are in the business of saving lives. Unfortunately, the business has become precisely that, just a business. I belong to that generation that has seen change as a rule. Change is the only constant in this profession. Guidelines change, treatments change, theories change. What was true today will be untrue tomorrow. What we firmly believe in today, we firmly believe it was wrong tomorrow. We are in a state of flux, and knowledge redundancy is a reality. Nothing as bad as a medical person who is not keeping in touch with his profession. I've heard young doctors say, that fellow, oh, he passed in 1990. He's a fossil. What does he know? So things are happening. We have changed from, there are certain painful changes also. You see, when I was a child, I had a doctor who was my family doctor. Anything and everything we went to him or her, and he gave us advice. And his word was gospel for us. Anything from myself to my mother's problems, to my father's problem, grandfather, grandmother, family physician. He was a skilled person. He knew me, he knew my background, he knew my family. Wonderful. I'll tell you a small incident. Whenever I used to have fever, the only big question everybody has even today is, what can my son eat? That was my mother's biggest concern. You can see the effect of her concern. So the doctor, the logic beats me even today. He used to say, hot rice and buttermilk you give him. And my mother dutifully would cook rice, steaming, piping hot, pour buttermilk, and every time this would happen, hot rice and buttermilk. Faithfully done, faithfully followed. Then I joined medicine. I said, what's the logic behind this? So I tried to find the answer. I didn't get any. I went to the hospital once. I just wanted to know what was the secret of the hot rice and buttermilk. And when I went to the hospital, I saw his photo with flowers. So he took the secret to his grave. So that is the family physician I'm sorely missing, because today it has become the days of the super specialist. I'm standing in front of you because my nephrologist is good. Otherwise, I'm telling you, today we have super specialization in everything. Before you have a cold, you go to an ENT surgeon. Now you go to a person who specializes in the nose, then the left nair, then the inferior turbinate. I don't know. We have a anesthesiologist, pediatric anesthesiologist, pediatric cardiac anesthesiologist. I don't know next what are they going to come up with, but they are here to stay. This is the future, specialization. Next, we are also saying that gone are those good old days of small, privately owned, family owned clinic, nursing home. Now it is all chain. One advantage is it gives a standardization of care. It gives a level of care that you can be sure. But unfortunately, that personal touch, that bonding between the beneficiary and the doctor is slowly evaporating. It is becoming all bottom lines. I'll come to that. The whole concept of beneficiary is gone. Now it is client. It's a business. I'm paying you, you're giving me a service. But technically, we cannot be equated to businesses in a conventional sense. That is where even we are confused, the government is confused, the judiciary is confused. We don't know what we are doing. But unfortunately, this is the future. We need to accept it and get the best out of what is possible at given these situations. Next, the evolution of a service into a business. The factors that are driving these changes is the cost of healthcare. It is going up prohibitively. Recently, I've heard of cases where medical bills have gone in excess of 6 and 7-figure sums, and I'm not surprised. This is what is happening. The cost is driving convergence, it is driving innovations. Next is the demand for better health care. Across the spectrum, the seniors here know the demand is increasing. Our lifestyles have changed. We have become sedentary. We are in the epidemiological shift where we are seeing a huge burden of non-communicable diseases, a huge burden of communicable diseases, and we are lost. We are lost. The healthcare planners are at a loss to organize and to deliver services. The demand is simply growing. The bottom line is our population pressures are telling, and this is leading to a lot of advances in healthcare. Technology, the bane of all professions. Today, IT technology is driving change. Robotics, genetics, you name it. The patient consults Google, Yahoo, and he comes, your lives, the youngsters who are sitting here, you think your examination vivas and you are scared of that? Wake up. Because once you pass, every patient does a viva on you. Every patient does a hostile viva on you. This is what that website says. How come you are telling something different? The patient has a right to appropriate, affordable care at your hands. The standards have to be maintained by all of us. The competition within the profession is a huge headache. Services are offered. You know, when I fell ill recently, I had to undergo an angiogram. I was contacted by people saying, my center has a good facility, that one does not have that much of a facility. This sort of a competition is going on. Many forms of competition are there. I'll not go into it because it's quite touchy. Then the government and regulatory bodies are also ensuring that there is progress. Standards of care are continually increasing. The continual escalation of standards is beneficial to the society that we serve. Next is the resource constraints are also a cause for this pooling of resources, the chain services and other things. We are in a country where we are constrained in all forms of resources, money, material, manpower, whatever you say, we have constraints. And this constraint, this shortage is a major cause for a lot of innovations that are happening. Then we have the downsides of the progress. Patient rights, awareness, and all has caused. There used to be a time when an appendectomy would be performed by doing a HB, TC, DC, that's it, or a BTCT at the most. Today, all investigations are done. Doctors are scared. They are running scared. All sorts of defensive practice has become the order of the day. Whether it is good or bad, it's up for debate. But the point is, the truth is, people are not ready to take calls on intervening. They want a lot of investigation backup. Next, the fear of litigation. Today, knowledge and the rights issue, doctors have become soft targets. You have all been, in the recent past, you have been seeing how doctors and healthcare providers have been at the receiving end. Very, very painful, but that's the sad reality of what's happening nowadays. Next is lopsided care pyramid. One of the topics that was suggested here to me was healing hands. Today, the healthcare delivery structure is becoming lopsided. The healthcare structure is inappropriate for the kind of care demand that is there in this country. We need a lot of these family physicians. We need a few specialists, and the apex of the care delivery, tertiary care, we need very few people. We have become urban-centric. Much to the chagrin of the government, the regulatory authorities, care providers are not going into rural areas. It's the sort of a very difficult choice. Now the government is thinking in terms of making rural service compulsory. Nothing that is made compulsory will work. But unfortunately, is there a choice? If everybody comes and settles down in an urban locality, who will serve the rural population? And, the demographics is we have a sizable rural population. And they are also now aware. They are demanding care. That care we are unable to provide. The reasons are many. The most significant of it being rural areas cannot cater to the lifestyles of doctors. I don't believe it, but that's what's the argument that's put up quite often. Next, role of multiple systems. Oh my God. Today, we have allopathy, Ayurveda, homeopathy. Each one has its role. I am not claiming ownership over healthcare delivery. Nobody claims. But the point is, the competition is unhealthy. The other day there was a joke. We were discussing in the university, what about the role of convergence of healthcare system? One of the friends of ours said, no, allopathy has a lot of side effects. We don't have side effects. I said, see, you market your strengths. Why do you want to harp on the perceived weaknesses of other systems? This sort of unhealthy competitions have started. Then patient pressure. How many of you practicing here? This question is not for students. Doctor A, will you assure me a cure? They want guarantees, warranty cards. I simply don't understand. Then unethical marketing is one huge problem that we are seeing. I don't want to blame any part of the healthcare delivery system. It is easy to blame, but I don't know. Early mobilization, according to me, is not a good thing. Everybody knows that in a hospital, the productive capacity of a bed is maximum when the patient is admitted. Subsequently, after all the interventions, it is just very minimal income. So move them out is probably the philosophy, which is not good. Targets are being fixed, which is not good. Healthcare is going out of the hands of doctors into the hands of people who don't know the social aspect of healthcare. People who don't understand healthcare are running healthcare system today. People who are very adept at numbers, bottom lines, profit orientation, return on investment. These are all languages which were alien to us. Because my teachers have taught me, when you treat another human being, treat from your heart. Today, the treatment is having a commercial connotation. As simple as that. The social aspect of treatment over time is disappearing. Skill is disappearing, the heart is disappearing, the brain has become unbearably cruel. Ethical issues involved nowadays are what community medicine people always say. Accessibility of healthcare. Are we giving equitable access to everybody? What Dr. Mahendra got in JSS will ABCD get in some place called Kathmarnalli, Kaitimnalli, some rural hinterland? What makes him less deserving of cutting edge treatment than Dr. Mahendra? These are questions that we need to answer. Today, we are spending heavily on tertiary care, on super specialist care, when we still have children dying of diarrhea. Where is the ethical justification of not investing in treatment of diarrhea? Where is the ethical justification for making the life of a MBBS qualified family physician not worth living? These ethical issues, today we have reached a stage where there is a debate on who's going to teach ethics. Before that, there is a question, is there anybody who is left in this profession who has the moral courage to teach ethics? The silence is deafening.